Hello, YouTube. It's been a super long time. If this is your first time checking in, my name is Ryan. I make transition related content, or I guess I used to. Here's me getting back into it. So, the reason for me getting back into it is because I had top surgery, finally. 15 days ago, I had top surgery. So, I wanted to make a little video about my experience, my surgeon, where I'm located, and just the process that I went through. So I am located in Massachusetts. So I had my surgery with Dr. Adam Tobias at Beth Israel in Boston. My experience so far with Tobias and the office and all of his staff has been incredible. I have not had any weird interactions. I never felt judged. I never felt like I was being misgendered or looked at differently. They've been through the ringer. They know what's going on and they know how to treat us, which I found hugely comforting, because I have a lot of anxiety around being trans in general and going through medical procedures. So it was a huge not just comfort, but it brightened up my day. I had my consultation in November of 2024. No, October. My apologies. My consultation was in October of 2024, and it went super well. I brought my grandmother with me. I showed up to the office. I slept through my original appointment because I work night shift and had to reschedule for later in the same day, and I showed up an hour early for my rescheduled appointment, and they took me right away. So that was awesome. The consultation was great. It was a little strange being manipulated, having my chest manhandled. But I know he's just doing his job. The surgeon has to see what he's working with, so I was able to kind of grit and bear it and get through it. He told me I was a healthy young man who was ready for surgery. And in November, we scheduled a date for January. So at that point, his lead time was about, November, December, January. 2.5 to 3 months was all I had to wait, which was awesome. I only had to wait 2.5 to 3 months for my surgery, which was, in all honesty, the perfect amount of time for me to prep. It was long enough that I had time to sit with my decisions and sit with the reality of the situation, but not so long that I started getting overly anxious. It wasn't so long that I felt the anxiety overcoming the excitement. So I found that to be perfect, in my opinion. Take a sip of my little juice here. We love juice. After my consultation, there wasn't too much interaction with the office. Not that there needed to be. I got an email with everything I needed to prepare for. They sent me a nice little sheet that told me what to expect leading up to surgery, what to do the week of, the day of, on all of that. About a week before surgery, I got a call from the office to do like a pre-check, where they call and they ask what medications you're taking, how much do you drink, how many drugs do you use, and they kind of give you some guidelines based off of that, what to do for the following week leading up to surgery. What medications not to take, what medications to make sure you do take. I've heard experiences of guys saying that they had to stop tea prior to surgery. I do the gel. I take the gel. I did not have to stop tea prior to surgery. I just couldn't apply it the day of before surgery, and I assume that's to make sure that no one gets contaminated or no one touches it who doesn't need it. Other than that, I didn't have to stop any medications. I got to take my mental health medication the day of surgery. Cool. Over this period of time, I bought all the things I needed to prepare. I have read a lot of articles and a lot of lists about what you might want to get yourself to prepare for surgery, but I work on a budget. Okay, I'm not rich, but I'm not poor. I don't like to spend money on things that are unnecessary, so I only got things that I deemed absolutely necessary. So the first of which, and I'll put up pictures as I go through, but the first thing I got was Hibiclens. Hibiclens is the antibacterial soap you need to wash yourself with the night before and the morning of surgery. It's red, it smells kind of funny. I kind of like it because it makes me feel super duper extra clean, but it's a medicated or medical soap. It's not supposed to be used all the time. So the first thing I bought was Hibiclens because that was not provided by my surgeon's office. The next thing that I got was wipes, shower wipes. I got these special acidified deodorant wipes that are made to be odor and bacteria fighting for up to 24 hours. And that's because I know and was told that you can't shower for the first 10 days post-op if you have nipple grafts, which I do. So I bought those two cleaning or self-hygiene items. In addition to self-hygiene, this is not something I bought, but about a month before surgery, Dr. Tobias' office actually sent me, covered through insurance, a box full of the bandage materials I would need for my nipple grafts. So it came with a wound dressing as well as Tagaderm, which goes over the wound dressing. And I'll show this all to you when I show you my chest later, what type of dressing that I'm doing. In addition to the cleanliness / hygiene supplies, I bought myself, as you can see here, a wedge pillow. Now this wedge pillow has 2 armrests on either side, and this has been the way that I sleep since I got surgery. You're supposed to sleep elevated and try to keep your arms not stationary, but for the first couple of nights try to keep them as chilled out and in position as possible, because you don't want to pull on anything, you don't want to rip anything. And mind you, for the first 10 days, actually 7 days only, I had drains in. I purposefully did not make a video while I had drains in because I personally, everybody's different, I personally was grossed out by my own drains. I didn't want people to see me with my drains in, and I actually avoided leaving the house as often as possible for the first 7 days because I didn't want to be seen with my drains in. To me, it feels like walking around with boogies on your face. I didn't want people to see my bodily excretions while I'm walking around, but that was relatively easy to do because the first 7 days you're on narcotics anyways, so I wasn't really leaving the house until I had to go to my post-op appointment. So before I get to my post-op appointment, I'll tell you the few other things I got to prepare, one of which was a lap desk, which you can see in the corner over there, and that's because I'm a student. I'm a full-time worker and a full-time student, so I needed to be able to do my homework sitting up in bed. This lap desk was awesome. It was like $27 on Amazon, which was a little more than I wanted to spend. I was hoping to spend under $20 on a lap desk, but this one was amazing. It's the perfect height. It's light enough that I was able to grab it myself and set it up myself. I actually also ate off of that lap desk for the first couple of days because I couldn't move my arms enough to bring food up to my face all the way. So having the lap desk at about this height was supremely helpful. The other thing, I didn't buy this, but as you can see, where's my finger? There you go. Right there is a grabber. I already had this because I like to go around and pick trash up. So I grabbed this out of my car and I sanitized it in the sink. I washed it off, and I used that to help me grab anything that I might have dropped or things in some cabinets that I might not have been able to reach. Look at my cat. The cat's right over here. What are you doing? He got caught. Yeah, so that was really all I bought. The wedge pillow, the wipes, the Hibiclens, the lap desk. And then I do recommend having a grabber if you're going to have top surgery, especially if you don't have someone with you 24/7. I'm single, so I don't have a partner. I have a roommate who's my sister, but she does work full time. So although she was here to help me in the mornings and at night, during the day I was kind of on my own. I did sleep through most of the tough parts, I would say days 1 through 4 were the hardest, and I was on narcotic pain medication, so I did, like I said, sleep through most of it. But having that grabber and that desk around for when she wasn't around to help me out, huge helps. The last thing I did that not everybody has the privilege of doing, I was able to shell out some money and get frozen meals. I didn't go to like a company like Factor or anything like that. I just went to Walmart and I bought a bunch of Healthy Choice meals. But I wasn't able to cook for myself, and I also don't like to burden people around me by saying like, I want chicken and broccoli and rice tonight. Can you cook all of that? So it was great to have just the option of popping in a healthy meal. And they're light enough that I could grab them out of the freezer with my grabber and just pop them in the microwave. My roommate actually moved the microwave to the front of the counter for me, so I didn't have to reach deeply into the counter to access it. That was huge. So beyond prep, all I could do was wait for my surgery date, which was nerve-wracking to say the least. Through my work, I had to go through this whole process to submit a disability claim to be put on a short-term disability to be able to get paid over the course of my time off. So I requested 4 weeks of time off, and my company is great. They're amazing at working with you for medical claims or anything like that. So they told me, more time, take it. Less time, no worries, come back. Whatever I and my surgeon decide is what my work is going to allow me. They're not going to push and pull and try to get me to come in earlier, which I thought was amazing because my last job, I used to work in the trades. So for my last surgery, my hysterectomy, my boss was like, can you come back? Can you come back? Can you come back? Can you come back? When I was not ready to come back, he did pay me for my time out, but he kind of held it over my head and made me feel like I owed him for that. So this time around, this surgery, having a new job, it was way better than my experiences in the past. So I guess besides prep, now we get to the procedure itself and the day of surgery. So Beth Israel requires that you show up an hour and a half before your surgery time. And all your restrictions are kind of based on your arrival time. So I couldn't drink anything 8 hours before my arrival time. And I couldn't, did I say eat? I couldn't eat anything 8 hours before my arrival time. And I couldn't drink anything 2 hours before my arrival time. Which wasn't too difficult because my arrival time was 9:30 in the morning for an 11 o'clock procedure. So the night before surgery, I had a huge meal. I had 5 guys. If you know, you can't go wrong with 5 guys. Probably about 10 o'clock at night was when I had that. And I was full up until surgery. I didn't feel hungry. I know some people experience being hungry, being thirsty right before surgery because you can't intake. But my schedule just happened to line up perfectly. I wake up the next day. I made sure to drink plenty of water because I woke up at about 5 in the morning. I live about 2 hours away from Boston, so I woke up early enough to shower, drink as much water as I possibly could before my cutoff time, and then hit the road to get to Boston. So I packed a bag. I wore comfortable pants. I wore comfortable socks. I wore a normal t-shirt and sweatshirt, like a pullover to surgery. But in a bag I packed, because I'm weird about clean clothes and re-wearing clothes. So I knew I was going to wear a different outfit to arrive to surgery than I would leave in. So in my bag, I packed, actually, it's been washed since, but I packed this zip-up sweatshirt, button-down shirt, a new pair of underwear, and a new pair of socks. I planned to re-wear the pants that I wore to surgery home. I arrived at the hospital. I check in. I'm waiting probably 15 or 20 minutes before they call me back. Now, it's not that they wouldn't I didn't ask, but they didn't call my sister/roommate back with me to begin with. They had just me go out to begin with. They do all these pre-op questions where they ask you basically the same things as the pre-check. But I appreciate thoroughness. They ask you about medications you take, when's the last time you ate, when's the last time you drank, have you ever had any adverse reactions to anesthesia, stuff like that. And then they give you a gown, a hair covering, also known as a bouffant, and a pair of socks. They also gave me a pair of hospital underpants, which I thought was quite nice, because you do have to disrobe at some point for the surgeon to come in and mark you. So it was nice to not be completely butt naked. And they did give me the male surgical underpants versus the female panty style, which I thought was nice. Because for my hysterectomy, they did give me the panty style paper underpants, which was kind of dysphoria inducing. But for this one, it was the male boxer brief style. So I was very comfortable. All of the nurses at Beth Israel, amazing. So nice. They actually have this program, and they brought me over a flyer because I have not legally changed my name and gender yet. It's kind of like my final steps. And with the current administration, I'll probably wait a little while. But I haven't changed my name or gender or anything like that. So they brought over this flyer, and they explained that they have a program at the hospital where if you're transitioning or gender non-conforming and you use a different name or different pronouns, they will give you a special hospital bracelet in addition, because you're required to have your legal name and legal information on your hospital bracelet so they know who you are. But they will give you a second one that's lavender colored that has your preferred name and pronouns on it, and everyone in the hospital knows to defer to the lavender one to address you, which I thought was a really cool program. I know some people might say, you're picking up breadcrumbs, just, thinking that this is the least they can do. But I thought it was amazing to have a hospital-wide initiative to just make people feel more comfortable and feel less intimidated by medical staff and personnel during a transition-related medical procedure. They were all super excited for me. They were all super happy for me. And I know this is Massachusetts, fairly liberal state with a fairly liberal and educated hospital system. But I still thought it was really awesome, really sweet, really cool. Made me feel super comfortable. So I'm just kind of chilling in a hospital bed for a little while after I get on this gown and socks. And then they let my sister come back. So we're just kind of shooting the ish. I'm trying not to swear on YouTube, so I don't have to edit anything. And then after my sister came back, they kicked her out for a few minutes because the surgeon came back. And when the surgeon came back, he asked me if I had any more questions. Once again, my surgeon was Dr. Adam Tobias, Tobias. He's super direct and personable without being. Like, I've heard people say that he's not very friendly, but I kind of appreciated his lack of warmth because it made everything feel super, like, we're moving ahead. We're just trying to get this done. And I personally liked that. He came back and he marked me. Wasn't anything too crazy. He had to put his initials on either side of me. He marked the tops, the bottoms. He made some other lines. He marked out some fat on the sides that they were going to take out. And then he did let me know that these marks are actually temporary. They're just a guideline. And when you get to the OR, they actually completely redo the markings. So the markings that you see on yourself pre-op are not going to be the final markings for surgery, which I didn't know. So I thought that was super interesting to learn. After that, I kind of hung out for another 10, maybe 15 minutes because they were just getting the OR all set for me. And then it was time to go back. So I have an IV in at this point, and it's no big deal. They actually put in medication to numb me before they even put the IV in, which I thought was super nice. I've never had that happen before. Even for my hysterectomy, they just put the IV right in. So I have an IV in. We start to go back. I don't remember at what point they started the medication that makes you all loopy, but I remember I made it to the OR. I physically transitioned myself from my hospital bed onto the OR bed, and helped them put like a pillow underneath my knees, and then I was out. I hit the mic, but I was completely out at that point. And then I woke up 4 hours later with a brand new chest. I woke up and I knew what to expect, but I was still super jarred by the fact that my chest was gone. I had no binder or anything on. I was actually completely shirtless with a blanket over me with my drains. And my drains were on my lower waist, like over my hips is where my drains were, just sitting on my bed. So I woke up and they were like, hey, good morning. Even though like it wasn't really good morning, but they were like, welcome, like you're awake. We're going to work on getting you sat up and then we can get you home. Once we get you sitting up, we can get you home. It was actually a super fast exit, I would say. I could be distorting time because I was on anesthesia, so I don't really know. But relatively quick. I remember waking up. They were like, we got to get you to the bathroom. Another thing, which I loved, for my hysterectomy, I needed a catheter, which was awful. I hated getting the catheter removed once I was awake because it was placed when I was asleep. For this surgery, unless they need to give you a lot of fluids ahead of time, and this is coming from a nurse, unless they need to give you a lot of fluids ahead of time, they will not insert a catheter. That's why they have you withhold liquids for a while. So I found that super nice. I hated getting my catheter removed last time, so it was nice to not have a catheter this time. The first thing they have you do is they have you get up and they have you try to use the restroom in case you have to use the restroom. Then they had my sister come in. It's a little fuzzy, so I'm trying to remember it. Then they had my sister come in. Once I was sitting up and it was determined that I wasn't feeling nauseous, I wasn't throwing up, no adverse effects from anesthesia, and they got me dressed. I sat up for another, I want to say 20 minutes, maybe 25, before they came in and they gave me my post-op instructions with my sister present, because obviously I'm not all the way with it. Gave me my post-op instructions with my sister present, and then got us on our way. Another thing that happened while I was asleep was they called in prescriptions for my narcotic medication, as well as an antibiotic. And while I was in the OR, my sister was able to go pick that up for me at the in-hospital pharmacy, which was super convenient. We didn't have to go anywhere else. She was just able to get it while we were already there. So after that, we began our 2-hour drive home. It's really only an hour and a half, but with traffic, it can turn into 2 hours. And at this point, I was just kind of sleeping. I was completely out. I slept for most of the drive home. We got in, we got up, and I just laid in bed. For the first 4 days or so, my sister actually kept track of my medication schedule, so I didn't even have to worry about it. She just told me, hey, it's time for your antibiotic. Hey, are you in pain? It's time for another pain med if you want it. What I liked was they gave me a pain management schedule that dealt with Tylenol as well as the narcotic that they gave me. And the way they explained it was try to hit the pain with the Tylenol, and if you need to, chase it with the narcotic a couple hours later. So that's what we did. I did use all of the narcotic pain medication that they gave me, but I found that after the first week, I really didn't need pain medication. I stopped taking Tylenol. Today is Friday. I had my surgery 2 Thursdays ago. My surgery, I never said the date. My surgery was January 23rd, and today is February 7th. I stopped taking pain medication, I would say, February 1st, if not before that. Yeah, I had, like I said, kind of rough first 4 days where I really didn't leave bed. I did get up and walk around just to move my blood and keep my body moving, but I didn't really do much. I scrolled TikToks. I did go to class on day 2 or online class, don't worry, I didn't go in person. I do all online school. But I did have to go to class on the second day, so I did that. No problems. I have never been on narcotic pain medication before because I did not take it for my hysterectomy. It just wasn't necessary. And I found that it didn't make me as woozy and crazy as I thought it would, which I found helpful because I don't like not being cognizant. I don't like not being in charge of my own actions. Look at my baby cat back there. Look at him. Yeah, so I found pain management to go really smoothly, especially with some help. And I had frozen meals, which I said were really easy just to keep me fed and moving along for the first 4 days. After that, I am neurodivergent, so I do have a difficulty sensing pain. I can sense discomfort very easily, but pain is something that I can't really register or decipher very well. But after day 4, my pain was very minimal. By day 7, I definitely was not taking any more pain meds. And by day 8, I had my post-op appointment. So my surgery was on a Thursday. My post-op appointment was the following Friday. Now, I do have to say that the worst part of these days leading up to my post-op appointment was emptying the drains. I get super nauseous and I get super uncomfortable around bodily functions and things of that sort. So I personally, I'm ashamed to admit this, I was not able to empty my drains by myself. I just couldn't do it. The thought of it, I actually passed out on the first night because I couldn't handle it. So it was huge having my sister there. She's also my roommate. I'll use those terms interchangeably. But we lived together, so it was huge having her there to be able to empty them for me. She wore gloves. It was the whole thing. And you have to track your output, actually. You're supposed to empty your drains twice a day and track how much fluid is coming out of them. So I don't have my chart anymore because you have to give it to them, and it's not like they give it back. But I would say I was at like 20 milliliters every time we emptied. And then by day 8, I was at about 5 milliliters, if not less, every time we emptied. So what they're looking for is to see that the fluid output goes down, and then they can remove your drains. So I showed up to my post-op appointment with my little chart of all my drainage. Gross. And I told them that I'm a passer-outer, because I am. I pass out at I pass out when it comes to medical things. I just get so anxious. It's called a vasovagal response that I don't know how it works. I'm not a doctor, but it's called a vasovagal response. I get so stressed about the thing happening that I make myself pass out. It's not from pain. It's not from anything happening. It's just stress. But I get to my post-op appointment, tell them I'm a passer-outer, and they're like, okay, cool. We're just going to do this all at once so that if you do pass out, it's not like you have to pass out and then wake up and then pass out again, because there's 2 sides, right? So I actually had 2 nurses in there. They put an ice pack on the back of my neck. I guess it's supposed to help. And on either side, one of them each pulled out a drain, and one of them each removed the nipple bolsters, which I did not pass out. So go them. They did a great job. And then I got a new sheet with all of my instructions for post-op care, what I'm supposed to do for the next 4 weeks, because my next appointment is not until some date that I will tell you in a moment, but 4 weeks away from my first post-op appointment. So we're at the post-op appointment. The only thing that I had anxiety over at the post-op appointment, other than getting the drains out, was what the sites of these drains, where the drain went in, what it was going to look like, what was going to happen with this site after the drains were removed. In my head, I assumed they would either put in a stitch or do some surgical glue or something. Nope. They just put a piece of gauze over it and they're like, it'll heal in a couple days. Don't worry about it. So with my anxiety, I was super nervous about it, but I got through it for I got through it for the 2-ish days it took for them to close and heal. It really wasn't bad. It was uncomfortable because for Dr. Tobias, he doesn't give you compression until after your post-op appointment. So you do not get compression with Dr. Tobias. And he told me this in my pre-op, my consultation. He told me to dispel this rumor. There's a rumor that Dr. Tobias doesn't use compression at all. That's not true. He will not give you a compression anything until after your post-op, once you get your drains removed. So after I got my drains removed, they put me in this, I don't know if you can see it. I'll stand back in a little bit. But it's just like a Velcro band that goes across the chest for compression. And you're supposed to wear this 24/7 for 2 weeks. And then for the following 2 weeks, only at night when you go to sleep. So it's a total of 4 weeks compression. But the latter 2 weeks is only half of the time. Less than half of the time. So it's no big deal. I am currently at 1 week post-op. So I have 1 week of 24/7 compression left. So when I left the doctor's office, they gave me this handy-dandy piece of paper. And I'm actually just going to read to you what it says on it. Not verbatim, but for the most part, what it says. Drains are out. Drain sites will heal from the inside out in 2 to 3 days. Deodorant can be used once closed. So I used deodorant about 2 to 3 days after my drains were removed. I want to say on day 3 because I wanted to be sure, and I was stinky enough already. So I just waited. It says, please wear your compression for the following 2 weeks, 24/7, and then 2 weeks just when sleeping. Please shower daily. If you have nipple grafts, you may shower after post-op day 10. So for me, my post-op appointment was on day 8 on a Friday. So on Sunday, I took my first shower. And once again, I was super nervous that I would pass out just because I'm terrified of confronting the fragility of my own body. So I waited till my sister came home from work that day, just so she could be home, and I took a shower. It was glorious. And at the time, the nurse told me, by the time you shower, you can put your hands up high enough to wash your hair, but we're not doing the Y. We're not doing the YMCA dance. And I'm still not at the point where I can lift my arms above my head. They're just high enough to wash my hair. And if I stand on my tiptoes, as I'm out of frame, you can, or I can reach stuff on the second shelf of my cabinets. So I'm getting a little bit more mobile. Anyways, so I wear a nipple dressing that they put on in office for me. And according to the instructions, I'm supposed to, or I am removing the dressing, taking my shower, and then putting on a new dressing when I come out of the shower. Once again, I'm super duper anxious, especially about the fragility and the unwholeness. I feel whole, but my body doesn't feel put together. I'm very anxious when my body is not at its peak, when it's not. That sounds like I'm a fitness guru. I'm not. I'm anxious when I'm not whole. I have stitches. I have incisions. That makes me feel not whole right now. It makes me feel too fragile. So showering has been exciting, interesting, as I deal with, running my hands over my own incisions and looking at my own grafts. It's anxiety producing, but it feels great just being here and knowing that I did this and went through it. Back to the paper. 2 weeks from surgery, start scar massage 1 to 2 times daily for approximately 1 minute. Firm circular motions in the shower with soapy water or a scar cream is recommended by the surgeon's office. As far as sun exposure, please keep scars covered or wear sunscreen to avoid hypopigmentation. Reapply as per the bottle or after submersion in water, and scars take a good year to mature, according to my surgeon. I can begin vigorous activity at 4 weeks And according to my surgeon, vigorous activity is anything that increases your blood pressure or heart rate. This includes lifting more than 5 pounds, repetitive bending, pushing, pulling, exercise, things of that nature. So I'm still not at 4 weeks, obviously. I'm only at day 15. So I haven't gotten back to anything vigorous, anything that even remotely resembles exercise, anything. After my post-op appointment with my drains coming out, you can start NSAIDs. So that means Motrin, ibuprofen, Aleve, anything like that. They recommend not using it prior to this point because it can promote bleeding. And when you have your drains in, you really don't want to promote bleeding. You want to reduce the amount of fluids that your body is pumping out of these surgical sites. No submersion in water. So I can't take a full bath or go swimming. Not that I do that anyways, but that's not allowed until 4 weeks post-op. And then they give me a phone number to call with any questions or any concerns that I have. And I haven't had any, which is huge. I actually feel as if I've been able to answer a lot of my questions on the Reddit, the r/FTM subreddit. And this is mostly to quell my own anxiety. I actually did get prescribed an anxiety medication just for the week of surgery and the week after surgery. So I actually just ran out of that medication, but it did help keep my anxiety down a lot, which I think aided my healing. Okay. I think that's kind of my whole process up to now. And it's time to just show you what my chest looks like post-surgery. It still feels weird being shirtless around people or showing my chest on camera because obviously that's not something I could do up until now, but I'm super proud of it. I think it looks really good so far. Although I'm still healing, so okay. I guess here's my trigger warning. Trigger warning, in the next couple of minutes, I'm going to show my chest. There are dressings on my wounds. There is an incision on my chest, or 2 incisions on my chest. And there is still marker from the surgery on my chest because I haven't scrubbed it hard because I don't want to like mess anything up. So it does look a little rough. So if you don't want to see anything like that, you heard the whole story. Now is the time to leave the video. I'm just going to show you my chest and explain what's going on, what feels good, what hurts, what doesn't hurt, what's sensitive, where I have feeling, where I don't have feeling. And that's it. So let's go. I kind of forgot I have a whole mic stand for this very purpose. But now I guess I'll do a little hands-free chest binder reveal. I know you can't see my face very well, but that's not exactly what matters here. So like I said, it's just like the strip of Velcro, strip with Velcro. And this is my chest. So as you can see, I have dressings on either nipple. And you can see where the marker and the surgical glue has been removed, where I'm continuously changing these dressings. My incisions go about halfway into my armpits. I don't know if you'll be able to see this one. Yeah, there you go. Which isn't too bad. I'm particularly happy with the low, I have very low, but it's there, muscle definition. So there is a separation in my chest. And if I turn to the side, you can see my pecs almost. That's not swelling. That is my chest. The lower half, there is swelling along the incision sites. I think, not that it matters too much, but I think I am happier with this nipple placement than I am with this nipple placement. My right nipple feels a little bit too far, but I really don't care. I know a lot of people get super precise and care a lot about, I mean, obviously we're paying good money for this. We care about what we're getting and where it's going, but I'm super happy with my chest, regardless of this nipple placement. See what I mean? It's just a little bit far compared to this side. But yeah, let me I guess I'll pull the camera in close and give you a good little, not 360, a little 180, I suppose. Still difficult to reach things. But this is my chest 15 days post-op. I have been showering every day, but like I said, I'm a little nervous to disrupt the incisions or anything like that. So I haven't been... Anyways, this is my chest. It's not the cleanest video I've made. It's not the worst video I've made. But this is where we're going to end it. Thank you so much for... If I can get back into the mic. Thank you so much for watching. Thank you so much for following along. Maybe I'll get back to making more transition-related content if I can. But like I said, I'm a full-time worker and a full-time student right now. So it's a lot to be creative. Hopefully this was informative for people. Sorry you can't see my face right now. If you have any questions, feel free to drop me a comment. Feel free to send me a private message. You can also find me on Reddit. I'm pretty active in the FTM subreddit. I'm New England Sparky. But I'll put those all in the description down below. Yeah, thanks so much for watching. I hope this was informative. I hope you learned something. And I hope you get top surgery soon, if you haven't gotten it. That's all I hope. And if you have gotten top surgery, congratulations. I hope you have a great rest of your night or day or whatever it is. It's night here now. And I'll see you on the next one. Good night.